Welcome back to Open Line. We are talking all things COVID-19, and I'm going to get right to the phone lines. Bill has been waiting for quite a while. Bill, thank you. What's your comment or question tonight?
Yes, excuse me, I got 6 children working for the Department of Education, State of Tennessee. I'm really outraged that they have been showing me all this messages on signs, online, Yahoo, or whatever, showing the straight get this shot. They're going to be sterilized and all this stuff. But I don't have 3 grandchildren, so something going on. Anyway, I'm just upset that they don't make the school teachers, because the Senate people are talking to all the garbage congressmen. They've gotten their shots. Even Trump got his shots. But I'm upset that they don't mandate them to get their shots when they walk around their children. Because when I went to school back in the 50s and 60s, you didn't have your shots, you didn't have that dress, you wasn't coming to school. So I'm upset that they didn't do that. So I've been upset at my children for not getting that shot. I didn't want them to come around me talking in politics and who said John and all the stuff right here. Don't come in my house. It means vaccinated. I'm a retired state employee, ex-military veteran, and I got my shots. It was all for one and one for all in the military. But since Trump got in office, you can tell these people are not taking a shot. I don't understand why he got the shots and they don't want to take the shots. I mean, this man is living. He was in the door and he thought he took the shot. And I just don't understand why if you work around children, especially children, you should get that shot. No question about it. And a lot of these teachers ain't got the shots. Yeah. It should have been mandated. I hope y'all have an opinion on this. Thank you.
Yeah, Bill, thank you for calling in. And by the way, thank you for your service as well. And you bring up a point that you wanted to talk about, but not necessarily vaccine mandates, but mask mandates in schools.
Well, absolutely. Well, he mentioned a great point there with our leaders and our legislators who are feeding into the fury that is a misinformed fury, by the way, in bringing politics into the practice of medicine and to the public health guidance, which absolutely should not be done. Because when we take an oath and we practice medicine, we don't practice medicine based on our own personal views. We do what is right for the patient. And when we have politics enter that relationship, our prescriptions then become red and blue, and that's not the way that medicine works. That's not the way that public health works. When societies like the American Academy of Pediatrics today put out a statement that above the age of 2, they are recommending universal masking in schools. Now, before that statement came out, you know, whenever you have medical societies or guidelines, anesthesia group has guidelines, they always say that these are guidelines, but the guidelines do not replace clinical judgment, that you always can break the rules in order to do what is best for that particular patient. And in that same way, we have the CDC sometimes sending us conflicting messages because they don't have the data. But then it is a great thing to have other societies that work as a team and help guide each other. And the American Academy of Pediatrics is a perfect example of that. And I have a feeling that we will start to see stronger messaging coming from other societies to encourage masking in our schools.
What are you expecting at the fall season once school gets back? Because several, well, I won't say several, a couple districts have already announced that they will not require masking in this area.
Yeah, I'm a little disappointed to see that. Even before masking was recommended last spring, again, you use common sense. You don't have to wait for a guideline to tell you what to do. We know that masks work. We know that it's a very simple thing to do. And it not only protects you, it protects the people around you. And talking about herd immunity, until we can get the vaccine, until we can get them for our children, this is a very simple thing to do. And my son walks around in a vaccine, in a mask. And when he is vaccinated, he will still walk around with a mask. And we're doing this for our own children. And like I said, we're not just the people on the front line. We are people with families as well. So I would like to see him, his classmates, the rest of the school, I would like to see them in masks. It's not so much about a mandate and making it political. I would like to see the community come together and do what is best for our children who are unable to get vaccinated.
When will you feel comfortable allowing your son not to wear a mask around?
When we don't have variants, when we don't have surprises. Now, the coronavirus is a living thing, and living things do what they need to do to survive. So the coronavirus does not know anything about politics. It doesn't know state lines, it doesn't know county lines, it doesn't know country lines. It's just a virus that's trying to live, just like every other living thing on earth is just trying to live. And so when it starts to get squashed by a vaccine, it tries to come back and it tries to mutate itself and it tries to make a variant so that it can survive. When we vaccinate and when we mask and when we squash that virus, it'll stop mutating and it has no choice but to die down. And that's when I would feel comfortable going without a mask.
Okay, let's go to, let's see, Nicholas is on the line. Nicholas, are you there with me?
Yeah, I'm here. How you doing?
I'm good, how are you?
I'm good. Can you hear me okay?
Yes, we can, go ahead.
I'm going to make it a long story short.
Okay.
To my question, the reason I decided to get vaccinated, I did wait because I was considering getting the Johnson & Johnson vaccine, and that was due to the fact that I work with a colleague that may need to be able to have to leave on emergencies for unexpected reasons. So I knew with the Johnson & Johnson it was a one-time thing. But then I waited till May. I wanted to make sure when I heard about more about the side effects of the Johnson & Johnson vaccine, I decided to go ahead and get the Pfizer vaccine. I waited till May, and I got the 2 doses. And my reason for getting the vaccine is I got COVID. Despite trying to wear the mask and social distancing, I still got COVID in November of last year. And I had to get around pretty much on my own for the most part. And some people wear masks, some people don't wear masks, and then hear about the Delta variant being more contagious. I keep my mask. I keep a mask with me, and I try to keep a backup with me, because I know with me wearing the mask, because when I wear the mask, it's only so long you wear it until you have to, or you really want to just take a breath air, and that only lasts so long, especially if I'm carrying stuff and walking, exerting myself. And my main so that's why I chose to get the vaccine. It's different strokes for different folks, so to speak. But long story short, is how concerned about the vaccines are with breakthrough infections, and 2, the Delta variant, and 3 as well, have they corrected the things they need to regarding the Johnson & Johnson vaccine?
Okay, that's a lot to tackle right there. Nicholas, thank you very much. Thank you very much, by the way. Go ahead.
Yeah, so I'll just say, Nicholas, first of all, thank you for doing your homework and learning about the vaccines and choosing the one that was right for you. That was a great decision. And I'd also like to say that you brought up another great point. After you've had the illness, after you've recovered and you're out of quarantine, it's the right thing to do to go ahead and get the vaccine. We think that we don't know how long the natural immunity lasts, and we think that you are going to need the help from the vaccine. So that was a great call to go out and get your vaccine.
How long are we thinking that the vaccine will last? I think that was one of his questions, until we might need another one.
Right. So I think the jury is still out on that. It's still being researched. It's data that I'm following closely. I was in the Moderna trial, so I'm pushing 12 months since my second vaccine, and I know that Pfizer in particular is working on a 3rd dose, hopefully this fall.
And when you talk to patients, and maybe this is, I know that you're more in the ICU, maybe this is when you're talking with families, he brought up the Johnson & Johnson vaccine, and just before we went on the air, I was listening to our newscast talking about Johnson & Johnson may be declaring bankruptcy, partly because of the problems they've had with their COVID vaccine. Do you advise people to get the Johnson & Johnson, or are you steering them other ways?
Well, I think that we have to look at the numbers overall. And, it's kind of like when and this is a really bad analogy, but, if you order a washing machine and you're very, very happy with it and it works great, you rarely call customer service and tell them what a great job they did. But if that washing machine comes and it's terrible and it was late and your delivery guys did a great job and it's broken already, ready. You're going to get on the phone and you're going to make sure that somebody hears about this. And this is a really bad analogy. However, it's part of our reaction, and it's part of the way that we report and what we're reporting. And on the other hand, we do have data that there have been some complications with the J&J vaccine. These are evolving processes, and we just want to fall back on the data that we have, knowing that vaccines do work and the benefits of those vaccines in preventing deaths far, far, far outweigh the risks. Now, if it's 1 in a million, of course, you don't want your child to be that 1 in a million. It doesn't matter if it's 1 in a million if it's your child. And that's what I tell parents. However, the odds are against you for not getting the vaccine, and we do know that. And we do know that you would be one of those ones who are protected, but we don't know if you're going to have side effects. So I phrase it in that way, and a lot of my families have been very receptive when they understand that. And so that's why it's very important to put things in perspective, and then make sure that you're getting your information from the correct sources.
Okay, we got to sneak in another quick break. We're coming back right after this.